Hey, what's up, everybody? Dr. Ryan Weaver here again with your wellness workshop. Today is going to be part two of our aforementioned part one workshop on wellness. So, to recap, last time we talked about 10 secrets for a long car life. What are 10 secrets to a long health? So, correlating those just as you would check the oil. You would check for rust, you would check the plugs, watch the timing belt, the radiator, filters. With our body, we regular spinal adjustments, helping our neurologic response, optimize our brain cognitive function, care for your body, stop treating your body, exercise. What are we eating? What are we drinking? All of those things. We also discussed Ralph Kinney's research with the number one cause of death in our country is poorly made choices. Then, towards the end, we got into the quality of aging, that we want a productive life rather than one that is with disease and decreased function, high injuries, high prevalence of comorbidities, and really the things that hinder our health. So, kicking off part two, before I dive into part two, actually do us a favor, like Facebook, like our YouTube channel. That way, every time we post these, you can get notified with our new production. So, again, the segue here, the U.S. life expectancy in 2021 from the United Nations was 78.9 for the United States. We also talked about 11 countries and our healthcare systems in performance rankings. We ranked dead last in all but one category. So, major declines in performance, time, and athletes in our age. So, backpedaling a little bit from the previous video we did, we knew that the American Journal of Sports Medicine stated that a major decline in performance didn't happen until age 75. So studies show that regular exercise and training can slow degeneration in bone density, muscular development, and balance in older adults. 3 physical functions that all decline with age. Although it is inevitable, and this has a negative effect on sports performance, the 2008 study of the Senior Olympics found that from age 50 to 85, that performance didn't dip until 75. So, backing up, in 2005 and 2009, what was found was within fitness club memberships, the fastest growing demographic was 55 and older. In 2005, it was 8 million. In 2009, it was 10.3 million. And that was referenced from 2011 with the Washington Post. So we know, again, the things that are good for us. We should be exercising. We should be eating healthy. We should be checking our posture. We should be checking all these things, not when we hit 55. But what about when we're 20, 30, and 40, those impressionable years? If you are able to maintain your spine in its proper form and posture from birth, it should it should not show signs of wear and tear until it was used in excess of 125 years. So, elaborating on that, some of the byproducts we've talked, and it's been a few workshops ago that we talked about the byproduct of aging and free radicals, inflammation versus aging, which we're going to shed some light on. So, aging as a byproduct, time, inflammation, cellular damage, and protein mass decrease. So over time, damage sustained, it's a lot like a snowball going down a hill. That damage is going to continue to worsen and worsen and worsen until we right itself and try to fix the problem. But again, most of us don't think of addressing that until a symptom becomes bad enough to say, hey, we're out of gas, vehicle's not moving, rather than maybe we should not wait until the gas tank is fully empty. Inflammation. This simmers over the years and decades, and it picks up collateral damage which continues to accumulate just like that snowball. And inflammation is designed to protect us from invaders that cause degeneration in the aging process. Inflammation is the body's response to injury. Cellular damage, a limited number of times that a cell can divide due to shortening of the telomeres, chromosomal structures. If you've been in our office, we've talked about telomere length, and through prolonged adjustments, how that can actually increase the length of that. And then decrease protein mass. So this is caused by lack of exercise, disuse, or atrophy. Easy example there. If you ever had a cast on, how the muscles decrease in size versus the good arm. Said lack of exercise, GI problems, cell loss, and loss of extracellular proteins. So what saves us in the short term kills us in the long term. Acute episodes of inflammation tend to turn into chronic ones. So diving into aging, our systems all collectively come together as a whole, makes up our body and our system. But we talk about respiratory system, nervous system, GI system, urinary system, circulatory system. Observable signs of these aging begin at different times. For reference, the nervous system at 20 years, circulatory system at 40 years, urinary system not until 65 years. So looking at all this together as a whole creates our human biology, and we have to care for all of these. So inflammation. I love to discuss this because we hear this a lot. We're going to get into corticosteroids here in a moment. Again, and inflammation versus aging. So causes of chronic disease. If you've been around us here at Apex long enough, we talk about chronic disease and how many of these things can be prevented. Chronic diseases that we hear: heart disease, diabetes, type 2, stroke, Alzheimer's, are just a few of those. So one of the markers that the University of Vermont School of Medicine stated was a C-reactive protein. Throughout this presentation, I'm going to go into just referencing it as CRP, is an accurate predictor of a future heart attack and is a better predictor than high blood pressure or high cholesterol. So, I'm going to read an excerpt here from the Journal of Clinical Endocrinology and Metabolism from 2001. Low-grade chronic inflammation independently predicts coronary heart disease better than high cholesterol and high blood pressure. Inflammation has been linked to insulin-resistant syndrome, diabetes. 2 large studies have suggested that markers of a low-grade chronic inflammation independently predicted those at a high risk for type 2 diabetes. So, what does all this mean? Well, C-reactive protein, CRP, could be a good predictor of the inflammation in our body, which we know the inflammation in the long term is a bad thing. So, jumping over to corticosteroids. Steroid injection kills off 50% of cartilage cells of a joint. That was from a orthopedic surgeon, a study in 2017. Again, I love referencing some of these studies. In JAMA, the Journal of American Medical Association, followed the outcomes of knee arthritis, patients who received repeated injections over 2 years with either corticosteroids or a placebo, a saline injection. Patients given steroids typically saw no pain relief and instead showed a faster progression of cartilage breakdown in the knee joint. So, keeping all this together, you're going to see some of the things we're going to get into: NSAIDs, aspirin, and things like that, which for inflammation, most of the time, those are recommended in our world now. And we're also going to talk about injuries that we can sustain with that. So, inflammation and aging. If aging is a consequence of inflammation, then you'll start to see old age differently. If old age is driven by an overactive immune system due to chronic inflammation, then it may be treatable. Inflammation causes aging, and aging causes inflammation. Our immune system is designed to protect us from infectious disease, which historically has been the number one killer of human beings. Inflammation causes aging. Waste products accumulate in our cells. Connective tissue elasticity reduces, and chromosomal damage. So, all this being said, what are things that we can do to decrease inflammation? Well, number one is a good mental attitude, not being stressed. Get checked for subluxations and remove those. Exercise, water, eat healthy. Again, these are so redundant and repetitive, and I know some of these things are boring. You're going to hear it all the time. Eat healthy, drink more water. Eat healthy, drink more water, exercise. All of these things are the things that we should be doing. Because again, we referenced that Kinney study from Duke University. The number one cause of death is poorly made choices. So, what I've seen in practice is a lot of people, I believe there's a shift now, is we'll wait for something to get bad enough and then get it checked. But if we thought about in our 20s or 30s and our 40s, that makes it a lot easier to live a functional, productive life in our 50s, 60s, and 70s. So, recommendations for the stress. This can cause an increase in cortisol levels. We know that cortisol up, stress is up, all of our health goes down. Reducing this stress lowers your heart rate and relaxes your blood vessels. Adjustments. So a chiropractic adjustment to a joint, to our spine. Swelling and edema happen at a subluxated joint, and the result is a production and release of small molecules called neuropeptides that can cause inflammation. So removing those with an adjustment can help restore proper biomechanics, allowing our joints to move properly and function properly, reducing inflammation. Adjustments are shown to reduce the production of type 2 inflammatory cytokinins, TNF-alpha, and interleukin-1 beta. This means adjustments not only reduce local inflammation, but reduce whole body inflammation as a whole. Exercise, one of my favorite things to discuss. Minimum 30 minutes at least 3 times a week. When I started in exercise physiology, we saw that really change, and it was more of like, 5 to 7 days a week you should do this, then it went to like 4 to 5, and now it's down to 3. So we gotta be doing, at least, in my opinion, at least 3 to 5 days minimum of exercise, 30 minutes each session. Good question on here is strength training versus aerobic. I believe they're both important. 2 to 3 days of strength training minimum per week. And typically they argue that aerobic is more important. Again, I like to weight train a lot, so I think both of those are equally important. This can help the biomechanics and our balance with the muscle development and the connection to our brain and body there. Water, water consumption. We usually say drink half your body weight in ounces of water, help flush out all the toxins, all the waste products, the byproducts. And then eat healthy. The biggest thing, keep inflammatory foods down. Processed foods, food colorings, sugars, we're seeing that a lot right now in the news. So we want to keep those things down because those can, again, create damage to the cell. All right. So we're going to go with the non-steroid anti-inflammatory part of this conversation, NSAIDs, over-the-counters, ibuprofens, aspirins, etc., etc., etc. I could go on for days and brands, but NSAIDs are some of the most common pain relievers available. They include over-the-counter medications, again, aspirin, ibuprofen, naproxens, but they're also available in prescription strength. NSAIDs not only relieve pain, but they reduce inflammation, lower fevers, prevent blood clotting. Since reducing inflammation is key in treating musculoskeletal pain, NSAIDs are considered usually the first line of treatment for this. But the American Gastroenterologic Association of Journal and Clinical Gastroenterology and Hepatology, that's a mouthful. Chronic users of NSAIDs have increased risk of bleeding and visible damage to the intestines. 71% showed visible signs of damage in the intestines just after 90 days of NSAID use. Daily, more than 30 million Americans take over-the-counter prescriptions such as NSAIDs for pain relief, headache, arthritis, like ibuprofen, naproxen, and aspirin. Here's a shocking statistic for you. More people die from NSAID-related complications than from AIDS and cervical cancer in the U.S. 16,500 per year and 103 hospitalizations from NSAIDs. So, let that sink in. All right. Again, some of this is probably going to be repetitive, but as we know, we lose muscle mass 1 to 3% per decade after the age of 50, unless we're doing some type of regular weightlifting exercise 3 times a week. Inflammation is like little waves on our shore. It's relatively low level of activity, but sustained over a long period of time, wears away at a beach, and other bad events occur. So, again, exercise, including weight training, tissue repair. So again, we talked about telomere, DNA with chiropractic care. Reduce free radicals, so increasing vegetables, fruits, antioxidants, reduce sugars, reduce drugs and alcohol, increase water, and increase oxygen intake into the cells. All right, so you heard me talk about telomere length, but let's talk about serum thiol, a steady indicator of DNA repair. Serum thiol, after long-term chiropractic intervention, showed that DNA repair can occur regardless of age with regular chiropractic care. That was a study from 2005. The serum thiol levels were highest in the group with 52 to 312 weeks of chiropractic care regardless of age. So again, when we talk about why it's important to get adjusted on a regular basis, even if you don't have pain, because again, it's about the system, it's about the host, it's about our whole body, not, hey, I have a pain here. So wrapping this up, we categorize our vital needs, something I talk a lot about. What do we have to survive? There are a lot of things that we could factor in here. Do we have to have a roof over our heads? Technically, no. You could sleep out under the stars. But top 4 vital needs, and think about these. Well, one is nourishment. We've got to have food. Okay, so if you're going to draw a pyramid on this, starting with the basis layer, nourishment. We've got to have food. How long can we go without it? 40 to 50 days, perhaps. Not ideal, but you could. The one just above food would be water. So if you pulled water, how long could you last? I've seen anywhere from 3 to 4 days, a touch longer, that you have to have it though. Again, it's vital. How about oxygen? We gotta breathe, right? I forget the world record, I looked it up, I think it was last year. I think it was something crazy in the teens in terms of minutes. But you could say anywhere from 4 to 10 minutes, then we start to notice decreased cognitive function, so 4 to 10 minutes with oxygen. In the top of the pyramid, number 1 that we have to have, how would you live if we eliminated a mental neural impulse? Your brain to your body through the spinal cord that creates function in all of our whole body, all of our parts, our muscles, our organs. If there's not a neural impulse, it's not working. Again, paraplegic, quadriplegics, if there was a damage to a nerve or a spinal cord, it may not work properly. So what are we doing in that regard? Are we checking our posture? Is your workstation a standing desk, or at least have the ability to do that? Are your shoulders back? Is your head back? Do you drive in your vehicle hunched over? These are things that we have to think of checking. So again, in closing, I hope this puts some perspective on things that you see with wellness. We should be exercising. We should have our spine checked for subluxations. We should be eating the right things, drinking water, oxygenating our body, eliminating free radicals. taking precautions in terms of what could we put in our body to help with antioxidants. Lastly, try to avoid over-the-counter drugs. Try to avoid corticosteroids. Think of your health differently at 20, 30, and 40 years old, differently than waiting until something happens down the line. As we mentioned, at 55, that was the highest spike in fitness club memberships. But what if we changed that? What if we started younger, but we kept that high throughout our entire life? What effect would we have on our community? What effect would we have on the whole healthcare system? So I appreciate you guys being here. A lot more statistics in part 2 of this workshop, and we'll look forward to seeing you at our next workshop. Everybody, hope you enjoyed that spinal workshop. Don't forget to like the video and feel free to share it if you learned something. Be sure to subscribe to our channel so you have quick access to our videos, and also don't forget to hit that notification bell so you are alerted every time that we post a video. You can also check out other spinal workshops by clicking right over here. Until next time, make sure you live your best life, and we'll look forward to seeing you at that workshop.